Hello students, we'll discuss a clinical condition in male actually, which is not uncommon. What this clinical condition is, look at that, look at this. You can see male patient, mustache is there, this identification mark. See that, this is the normal breast. See that, hypertrophied breast, the right side. Looks like female breast in a male patient. This is the normal left one. Many times it may be bilateral, but male patient you can identify mustache is there. So naturally male, unless the hirsutism, and naturally male patient, large female breast, female breast like in a male individual. That is called gynecomastia. It is hypertrophy of male breast more than usual, with the increase in the ductal and connective tissues both. That is important. Having features of female breast. So you can look at this, looks like. So it can be unilateral or bilateral. Here it is unilateral. It can be symmetrical or asymmetrical, one side larger, another side lesser than larger. Both are pathological, of course. Due to estrogen excess, it can cause, or androgen deficiency, if it is same, or drugs. Many drugs can cause. Drugs again cause, either drugs can cause, groups of drugs can cause estrogen excess, groups of drugs can cause androgen deficiency. Eventually outcome is same. Diffuse or well localized. Well localized is hard usually, under the areola usually. Diffuse is entire like this. It is the diffuse one. Neonatal in newborn, pubertal, young individual, young child, senescent, prepubertal, and classification, Simon's classification, 1, 2A, 2B, 3. Remember, rule out systemic causes like liver disease, liver failure, drug-induced, hormone-related. Rule out carcinoma male breast, it is important. Because sometimes it may mimic. Rarely, gynecomastia may turn into carcinoma male breast, but breast lump in a male, carcinoma is a differential diagnosis because it's very important, because carcinoma male breast is more aggressive than the carcinoma female breast. It spreads earlier, and lymph node element is common, thread is common, metastatic disease is common, and more aggressive. And so outcome is poorer compared to carcinoma female breast. That's why you have to remember whether it is carcinoma or not. That point is important. And occasionally, not commonly, occasionally, gynecomastia may turn into carcinoma, especially when it is associated with the different syndromes like Klinefelter syndromes and so on. So rule out carcinoma male breast, ultrasound, mammography, FNAC, or true cut biopsy. That is ideal. It's a true cut biopsy. All of you know that. That is the ideal thing. Ideal is a true cut biopsy. Hormone assay is important in all gynecomastia male. Any testosterone level, estrogen level, prolactin level, and so on. Treatment is subcutaneous mastectomy. It's a common thing. Reduction mammoplasty, treat the cause, liver failure. Or if drug induced, to remove the, replace the drug, change the drug. Don't give like cimetidine or other thing. Change the drug, so it will become all right. Many liposuction is used, then many drugs are used to treat gynecomastia. Many times it may recur also, but ideal treatment is subcutaneous mastectomy. There are so many other things have come now, laser, cryo, and so on. With the results are not equal like a subcutaneous mastectomy. So answer the MCQ. Remember, gynecomastia is a short note for you. In the exam, maybe kept as oxy, short case also. So everything about gynecomastia you should know. Many MCQs will be asked in the gynecomastia. That's why it is again very important for undergraduate exam and postgraduates also. So answer the MCQ. Commonest cause for gynecomastia among below is Sertoli cell tumor, B. Leydig cell tumor, C. Turner syndrome, D. prolactinoma. Answer the another MCQ. So what this incision is, see that this incision, like this I have put this dot I put. So what this incision is, Lance incision, B. Gallard-Thomas incision, C. Cocker's incision, D. Webster's incision. So give the correct answer and also think what other incisions other than correct answer are, so that you can learn much more. So please put your answers in tomorrow's comment box so that I will give the reply with the reasons. So don't favor, I request every student to give the answer so that it will increase your knowledge about the MCQ as such. Please go through my SRB clinical methods in surgery current edition with the video lectures how to examine all different patients, surgical patients. They given very nicely with illustration, photos and videos. And my manual of surgery again gives everything as per CBM syllabus is covered everything, SRB manual surgery current edition, everything essential thing for exam, MCQs, everything with the MCQs online is given. And my atlas of my atlas operative surgery, which gives with volume 1 and 2, gives a procedure, minor to major procedure in detail with the illustration principles. And atlas of tissue approximation gives the suturing technique with the video and with the principles. My Diginor lectures covers everything A to Z surgery with the specialties, instrument, specimens, operative surgery and images, which is useful for the undergraduates and postgraduates early learning. 1 year you can subscribe, and definitely it will improve your knowledge, help in your exam and learning also. So students, I hope you understood this lecture very well. Thank you very much.